When you see something, say something. Just don't turn your head.
A West Palm Beach man took on a multi-billion-dollar corporation and helped secure a $300 million settlement for the federal government in our nation's battle against the opioid epidemic. The U.S. Department of Justice announcing the settlement from Walgreens this week, crediting whistleblowers for bringing the case to light.
One of them sat down exclusively with WPTV's chief investigator, Jamie Ostroff. Jamie, what did he tell you?
Well, he told me he did it for a greater purpose than the career that he was a part of for decades. Now, the settlement claims that for about 10 years, Walgreens knowingly filled numerous illegitimate opioid prescriptions. And Dr. Elmer Mosley was one of 4 Walgreens employees who saw something wasn't right and spoke out about it.
When you finish pharmacy school, you take an oath.
Dr. Elmer Mosley worked for Walgreens for about 50 years, working his way up from intern to pharmacy manager.
And that is life first. Preservation of life before anything else. I took that oath. I meant it.
In 2013, Mosley says he began to notice some prescription requests that didn't align with that oath.
And after I saw it that way, I didn't get any results. Nothing changed.
Mosley says he tried to report the suspicious prescriptions to his employer and that he was reprimanded when he declined to fill them.
You take it home with you. It's your kid. And sometimes you can't sleep. That you know that 240 I just filled were way too many.
Mosley eventually resigned.
What drove him to speak out was human lives, you know, and seeing and knowing that if I do this, if I continue to do this, we're going to continue to see people dying, and he just couldn't do it any longer.
Saya Baker Barnes and Adam Rabin represented Mosley as a whistleblower in this 2018 DOJ lawsuit against Walgreens, targeting its alleged practice of filling opioid prescriptions that in some cases were not for a legitimate medical purpose.
We're not only advocating as lawyers for our client, but we're actually advocating for an improvement to society and social purpose. Putting profits over the safety and health of patients is not going to fly in the long term.
The settlement requires Walgreens to pay the federal government upwards of $300 million. The pharmacy chain will also have to enter into a corporate integrity agreement.
Those agreements are designed to tell them what they need to do in order to ensure that they're doing the right thing when no one is watching.
The settlement states that it is not an admission of liability by Walgreens, which told me in a statement that it, quote, disagrees with the government's legal theory and that our pharmacists are dedicated healthcare professionals who care deeply about patient safety and continue to play a critical role in providing education and resources to help combat opioid misuse and abuse across our country.
It's not about the settlement, it's really about the lives that I saved.
Now, much of that $300 million settlement will go back to the government and those government-funded health care programs like Medicare, Medicaid, and TRICARE as a reimbursement for the allegedly fraudulent prescriptions those programs had to pay for. The 4 whistleblowers will also get a portion of the settlement money. This is something the federal government typically does by policy to incentivize everyday people who hold the powerful accountable.